friend. It warns the person that whatever he or she is doing is perhaps not right. So is to stay off those exercises which hurts a lot, and just modify your exercises. So, for example, running causes you pain, then I would just modify that to stay fit, like cycling or swimming or elliptical or walking in the water. And they can ice the knee, especially towards and then end of the evening, 5 to 10 minutes at a time, they can ice the knee. And of course, take 3 or 4 days of over-the-counter painkillers and see if it gets better in a week or two. And most of the time, it's just enough to do that. But if you have tried these measures and it's not getting better, then of course I would see a doctor.
And a lot of times, Sanjay, is the problem not with the meniscus or the cartilage, but with what we call a bursitis.
Exactly. Yeah.
And because sometimes I see this with young kids, they're jogging more than they'll jog 5-6 miles in a day. They'll complain that their knee hurts, but they're weigh 110 pounds. And I can't believe that they've got a serious
condition.
I don't send them right away for X-rays.
Sure, absolutely.
Is that strange?
No, it is quite common, and bursitis is more, in the hip area than the knee area. The knee area bursitis is to be very common at what we call as a housemaid's knee or a clergyman's knee, and essentially anywhere you have a bone which is kind of has a pressure when you're walking or sitting. Nature gives us a fluid-filled sac, like a tiny balloon, if you can imagine, and that balloon acts as a cushion to that bone being pressed. And say, for example, you have a housemaid who, in the olden days, there's no vacuum or any gadget. They had to kneel down on the floor and scrub the floor. And when you kneel down on the floor, you're rubbing that little balloon or the sac onto that floor, and it gets irritated and it's to swell up. Or clergies is to kneel down in churches and this to swell up. We don't see that often. We do see in people who kind of jobs involved technically kneeling on the floor most of the time. And the way to prevent that is to put a cushion onto the knee. That way you're not having a direct pressure onto that area. So that's a good prevention. But sometimes we do see that, and that treatment is very simple. As saying again, it's just icing and avoid pressure on that area, wear a cushion pad in that area, and take some sort of anti-inflammatories like aspirin or Motrin over the counter. In the hip area, that bursitis is quite common, and that's usually on the side of the hip. And people usually complain of, when I walk it's okay, but when I turn, my side of the hip hurts, or I just can't find a comfortable position at night while I'm sleeping. So basically you sleep on your side, there is a little nubbing of bone, if I may show.
Essentially,
this is a hip joint. As you can see, the hip has a thigh bone here, and it has a ball, as you can see, a ball and a socket. So hip is a ball and a socket, and that's deep in the groin. So if you put your hand in the groin, it's kind of an inch behind that skin into your hip joint. And the outside is this nubbing of bone. So when you sleep, you're actually sleeping on this nubbing of bone. And so there is a little sac here which acts as a cushion, and that sac gets inflamed over a period of time. And that's usually when the tissues is quite tight over this area. So again, to prevent this, stretching is very good at that. And if you stretch and do things like yoga or Pilates or Tai Chi, whatever one fancies, and keep that stretching going every single day, and that or swimming, that keeps it.
Stretching is good.
Yeah, stretch is good.
Good, Sanjay. I believe it now we're down to 5 minutes already. Well, you brought some great show and tell here. Why don't we just show people what you do when you give them a new hip?
Okay.
With the hardware you put in. And
so what we do in a new hip, hip is a ball and a socket joint, and essentially the ball and the socket is kind of it's not good anymore because the cartilage is worn out. And what we give them is a new ball and a socket. So this is a thigh bone, and this is the top of the thigh bone. And if I move, and you can see there's a ball here, and we cut this down here.
It's cut off.
And that is how it looks. If this is your thigh bone, we have cut off.
Cut off the top.
And then essentially we put a pin inside, And if you look at this pin, it has it's quite rough here, and that bone, and the bone kind of grows onto it, and once it grows onto it, it becomes part of the body, and that has a new ball, which is traditionally made of metal, but can be made of other material, and then you have a socket. Then you have a socket, and that socket has a bearing material, typically a plastic, and you put that together, and that becomes your new ball and socket. And this is one of the most successful operation ever designed by mankind. It really changes quality of life of a person way beyond any other operation. And majority of the people who have hip arthritis, who've had this done, will tell you, why did I wait in pain for 1 or 2 or 3 years? I should have had this done much earlier, because the improvement in pain is just dramatic. Yeah.
And Sanjay, that surgery lasts for quite a while, right? I mean,
the operation takes about typically an hour to do, and a person stays in the hospital for 3-4 days, and they can go home and recover. And the modern materials are good enough that they can last you 20, 25, 30
years. Yeah, that's what I was getting at. It lasts very good. And we're down to 2 minutes. Now, sometimes they do these with ceramic. Do they
absolutely. I mean,
many different types.
Many different types, and you can have ceramic on ceramic or a metal and metal. And ceramic and ceramic, this is exactly essentially a hip, which is ceramic and ceramic.
Well, that's a ceramic.
That's a ceramic ball, and that's a ceramic liner. So the coupling is ceramic and ceramic. But the advantage of this is this is much harder than a plastic. So it is actually the hardest material, even harder than diamond.
That's
ceramic, absolutely. So it wears almost negligible over a period of time. So if a person is young, say a person is 50 years old, has a hip arthritis, wants to get a new hip, this is one of the options, because it will last a person a very, very long time.
So if the younger they are, you might go with one of those.
I would go with either a metal and metal or ceramic, because it is a harder material, as tough as diamond, is going to last for a very, very long period of time, as compared to, say, a socket, which is the inside of which is made of plastic.
Or maybe for an older patient.
For an older person. And it's very, the operation is essentially the same. You remove the plastic, the outer socket remains the same, and you just put a ceramic liner, and that's how it works.
Well, folks, I told Sanjay, as I tell all my guests, the show is usually over before it started. We just got a few seconds. Well, hopefully you'll never need a hip, but if you do, Sanjay is one of the very qualified people we have in the community to do this sort of thing. And I hope you learned a few things about how to keep your joints healthy. As Dr. Gupta said, the most important thing, particularly for the knees, but the hips too, just to keep mobile. And you don't have to do anything extravagant. Just plain walking is good enough. And if you have any unusual pains, it's particularly going up and down stairs, knee starts to hurt, hip starts to hurt. Of course, you might want to just slow down for a few days with a little bit of ice and Tylenol or Aleve, something like that. Then you see your family doctor. If he can't help you, you put you in the hands of somebody like Dr. Gupta. Sanjay, thanks, folks. We'll see you the same time next year. We got to run. I wish we could have spent a little bit more time together.